Have you ever been in the middle of an important task only to feel your thoughts slow down or even disappear? Or felt that your mind is in a state of buffering, like waiting for a video to load with an unstable internet connection? That sense of mental cloudiness where your brain feels like it's moving through molasses is called brain fog. Brain fog isn't a medical diagnosis, but it's a term used to describe a collection of cognitive symptoms, including difficulty with concentration, memory lapses, confusion, and mental fatigue. It can feel like your brain has checked out, leaving you struggling to think clearly. Symptoms can range from mild forgetfulness and lack of focus to more frustrating experiences, like the inability to recall simple information or getting easily distracted. It's as if the mental clarity you're used to is hidden behind a thick layer of fog. Brain fog can have many underlying causes, often linked to lifestyle factors. Sleep deprivation is a leading contributor. When you don't get enough rest, your brain can't process and retain information properly, leading to slower thinking and forgetfulness. Chronic stress is another big factor. Prolonged periods of stress elevate levels of cortisol, which interferes with brain functions like memory and focus. Diet also plays a major role. Without the proper nutrients, especially those essential for brain health like omega-3s, B vitamins, and antioxidants, your brain simply doesn't perform at its best. Hormonal changes can also leave you in a mental haze. During pregnancy and menopause, shifting hormone levels affect neurotransmitters in the brain, which can lead to cognitive difficulties. Thyroid issues, too, are linked to brain fog because of the impact hormones have on brain function. Brain fog isn't just about lifestyle. It can also be tied to more serious health conditions, like autoimmune diseases such as lupus, multiple sclerosis, or fibromyalgia. These conditions often bring inflammation that disrupts normal brain function, leading to cognitive impairment. People undergoing chemotherapy often experience chemobrain, a form of brain fog that results from the treatment's impact on cognitive processes. Similarly, individuals recovering from illnesses, especially post-viral syndromes like long COVID, may also experience prolonged mental cloudiness. Mental health conditions, such as anxiety and depression, can also play a role. Both conditions impact brain chemistry, causing symptoms like difficulty concentrating, forgetfulness, and an overall sense of mental fog. Though brain fog can feel overwhelming, the good news is that there are effective ways to manage it. First, focus on improving your lifestyle. Prioritize sleep. Your brain needs adequate rest to restore cognitive function. Aim for 7 to 9 hours per night and stick to a consistent sleep schedule. Eat a brain-healthy diet. Include foods rich in omega-3s, like fatty fish, along with leafy greens, nuts, seeds, and whole grains. These nutrients fuel your brain and support sharper thinking. Exercise regularly. Physical activity boosts blood flow to the brain, which helps clear out toxins and improve mental function. Even a brisk walk or yoga session can make a difference. Don't forget to manage stress. Chronic stress is one of the most common triggers of brain fog, so taking time to relax and recharge is essential. Practices like yoga, mindfulness, and meditation can significantly reduce mental fatigue. If you're finding it hard to focus, try writing things down. Making lists or jotting down reminders can help you stay organized and on track when your brain feels a little foggy. Breaking tasks into smaller steps can also prevent mental overload. Set realistic goals and take regular mental breaks to keep your brain refreshed throughout the day. While these strategies can help, sometimes brain fog is more persistent. If your symptoms are affecting your daily life or lasting for more than a few weeks, it's time to see a healthcare provider. They may recommend treatments based on the root cause, such as managing an underlying medical condition or adjusting medications. In some cases, therapy might be beneficial. Cognitive behavioral therapy, or CBT, can help rewire how you approach tasks, improving both memory and focus. Additionally, some patients find relief through medication, particularly when brain fog is linked to anxiety, depression, or autoimmune conditions. The duration of brain fog varies. For some, it might last a few days, especially after stressful events or poor sleep. For others, particularly those recovering from illness or medical treatment, it can last for weeks or even months. The key to recovery is identifying the cause and taking steps to address it. Brain fog is more common than you might think. It affects people from all walks of life, whether from chronic stress, medical conditions, or viral recovery. In fact, studies show a rise in cases related to long COVID, with millions of individuals reporting ongoing cognitive challenges. The journey to clear thinking might take time, but with the right lifestyle changes and support, many people can lift the mental fog and get back to feeling sharp. Whether it's improving your sleep, diet, or managing stress more effectively, small changes can have a big impact. Brain fog may slow you down, but it doesn't have to stop you. By addressing the root causes and making intentional changes, you can begin to lift the fog and reclaim your focus.